All right, I'm gonna do the intramuscular injections. First, I'm gonna state our sites for IM injections. It's gonna be dorsogluteal, ventrogluteal, deltoid, vastus lateralis, and rectus femoris. All right, first thing we're gonna do is we're going to verify our doctor's orders with our MAR. We are going to check for patient allergies. We're going to perform hand hygiene. And we're going to look and see the last time and date, the last time and location this medication was given. Is it safe to give this medication yet? All right, now that I've washed my hands, I'm gonna go to the medicine room and prepare my medicine. I'm gonna need my 3 milliliter syringe, my alcohol pad, my medication, and the correct needle to replace my needle with. And also I'm gonna need my MAR. Now I'm ready to prepare my medication. I'm gonna do my 3 label checks. I'm gonna check it when I pull it, check it when I do it in my syringe. I'm gonna check it when I put it back. I'm gonna check the medication against the MAR. I'm gonna see, do I need to do calculations? Yes, I need to do calculations because it states if a patient is recovering from a hip replacement surgery and the rates their pain as a 10 on the pain scale. There is an order for morphine 7.5 intramuscular as needed post-surgical pain. I'm going to check the name of the medicine, the expiration date, and check for particles. All right, I'm going to do my calculation. The doctor ordered 7.5 milligrams. It comes in a 5 milligram per 1 milliliter dose. 7.5 divided by 5 it's going to be 1.5 mLs. All right, here's my work. All right, now I'm ready to withdraw the medicine. I'm going to remove the plastic or metal cap from my medication vial. I'm going to clean it for 30 seconds and allow it to air dry. Remove my needle cap. If I'm doing 1.5 mil of medicine, I'm going to draw up 1.5 of air. There's my 1.5. All right, insert the needle into the rubber port, inject the air, invert my bottle, withdraw 1.5 mils. Going to remove the needle from the bottle, gently tap if I have any air bubbles, push the medication to the tip of the needle. I'm going to recap my needle using the scoop method. All right, now I'm going to change the needle. I'm going to make sure I'm using the aseptic technique, make sure my needles aren't touching the countertops and things like that. So I'm going to open my correct needle. I'm going to clean my needle, take this one off, put it in the sharps, clean my syringe. Now I've got the needle that's ready for the patient. All right, now I am going to gather my supplies to go to the patient's room. Going to need my MAR. Going to need my new needle with my syringe that's got the medication. Going to need my alcohol pad, my cotton ball, my Band-Aid. I'm going to go to the patient's room, get the patient to verify their name and their date of birth, check the patient's armband. I am going to perform hand hygiene, don gloves. I'm going to get the patient to verify their allergies. I'm going to make sure that there's not any extra allergies that they say they have that may not be on their MAR. I'm going to get the patient in a comfortable position. I'm going to make sure they don't need any extra privacy. Now I'm ready to give my patient their injection. Locate the site. Clean with an alcohol swab for 30 seconds in a circular motion, inward to outward. Let it air dry. Remove my cap from my needle. I'm going to insert my needle. I'm going to do the Z-track method to insert my needle at a 90-degree angle. I'm going to hold it like a pencil, insert it in dark light motion. I'm going to aspirate, make sure I do not get any blood. If I do not get any blood, Going to inject the medication into the patient. Going to remove, flip my safety, put it in the sharps, hold gentle pressure, apply a Band-Aid if necessary. I'm going to get my patient back in a comfortable position, and I'm going to take my gloves off. I'm going to perform hand hygiene, and now I'm ready to go document. I'm going to go document who, what, where, when. I'm going to initial my MAR, and after 30 minutes, I'm going to go back and check on the patient to verify the medication and the patient's reaction to that medication. And now I'm done.